Hello everybody, welcome to this live talk hosted by the University of Hyderabad unit of the Students Federation of India. I am Subin Dennis. I work with a research institute known as the Tricontinental Institute for Social Research. I have been asked to talk about Kerala's response to COVID-19. The way the state of Kerala has tackled the coronavirus pandemic has garnered widespread attention. A lot of national and international media outlets have published reports which say that Kerala has managed a very robust response to the pandemic. Today I will be trying to answer the question why Kerala has been able to manage this kind of response. I am not going to say that Kerala has already won the battle, it hasn't. The Kerala government also recognizes this, that there is no room for complacency. There is still the danger that things might get out of control, even if there are small mistakes. The utmost vigilance will have to be exercised in the coming weeks as well. Nevertheless, we know that the mortality rates in Kerala due to coronavirus, or the case fatality rate, is among the lowest in the world. The state has been able to limit the number of deaths to just 3 so far. That means the mortality rate would be 0.67% and the recovery rate is very high, 74%. The number of new cases has been coming down significantly, such that the number of people who were recovering exceeded the number of new cases until a few days back. Although in the last 3 or 4 days, there have been a few more cases. Nevertheless, in general, Kerala is seen as having handled the crisis well. We could say that there is some success in relative terms, definitely. So what lies behind this? First, I'll try to summarize what Kerala has been doing since late January. So that will be in 2 parts. First, the measures strictly related to COVID-19, and second, the socio-economic measures taken to alleviate the difficulties that are caused to the people due to restrictions on economic activities. The approach and the strategy which are mentioned in the title of this talk. So the approach and the strategy might be apparent while I talk about these measures, but I'll try to outline it more explicitly towards the end, and then come to the political economy of these very briefly. Basically a very brief look back into the history of how these were made possible. Let's start with the measures that Kerala had taken to deal with the coronavirus outbreak. Many of you might already know these things, but a recap is important. And it might become even more interesting if we occasionally intersperse it with what was happening elsewhere. We all know that the scale of the coronavirus outbreak in China was becoming obvious by mid-January. Most world governments had not really woken up to the danger, not yet. The first meeting on this issue in Kerala was convened by K.K. Shailaja, Kerala's health minister, and that was on 18th January. Wuhan had not yet gone into lockdown. China's National Health Commission confirmed that the virus can be transmitted between human beings on January the 20th. On the 22nd, the Kerala Health Department sent an alert to all hospitals and district authorities about the need to prepare for a contagious virus. And the next day, on the 23rd, China locked down Wuhan. The day after that, on the 24th, Kerala set up a control room in the Directorate of Health Services, and by that day a detailed set of guidelines were framed based on the protocol developed by the World Health Organization, focusing on physical distancing, hand hygiene, and the option of quarantine. That was the day when China shut down another 15 cities. On January the 25th, the Kerala Health Department issued guidelines to health officials and local self-governments on the measures to be adopted. It was decided to locate and screen everybody who had returned from the virus-affected regions of China. On January 28th, control rooms were set up in districts. Isolation facilities were also set up in districts. The first case of coronavirus in Kerala and in India was reported on January the 30th. This was a medical student who had returned from Wuhan. That day, the World Health Organization declared the novel coronavirus outbreak as a public health emergency of international concern. Soon, 2 more tested positive in Kerala on February 2nd and February 3rd. On the 3rd of February, Kerala declared the epidemic a state calamity. By that day, more than 2,200 people who had returned from coronavirus hit places were under quarantine. The vigilance exercised by the state proved to be effective. All three patients till then fully recovered in a few days, and there was no case of secondary spread. The number of people under quarantine began coming down, and on February 7th, the Kerala government withdrew the state calamity warning. But in late February, as coronavirus spread to even more countries, and in particular to Italy and other European countries, the influx of people from virus hit regions intensified. Several people, initially those coming from Italy and later those coming from countries of the Persian Gulf, they also tested positive for COVID-19 when they came to Kerala. A few who came into contact with those people also contracted the disease. Meanwhile, on February the 25th, India's Prime Minister Narendra Modi hosted a big rally in Ahmedabad, Gujarat, with his close friend Donald Trump. There were more than 100,000 participants at that rally. Trump, by the way, on 29th February called the pandemic a hoax perpetrated by the Democratic Party. On the 4th of March, he said it is very mild. On 7th March, he said he is not concerned at all. On the 10th of March, he guessed that it will go away, just stay calm. So with this kind of approach, the United States now has more than 50,000 deaths. So they are approaching the halfway mark when compared to the casualties they had during the First World War. And meanwhile, Gujarat has India's second highest number of cases, 2,254 active cases, and the second highest number of deaths, 112. But these came later. Let's go back to the timeline. On March the 12th, the WHO declared COVID-19 a pandemic. On March the 13th, India's health ministry officials said coronavirus disease is not a health emergency. Meanwhile, the total number of positive cases in Kerala rose to 27 as on 18th March. It was the second highest among Indian states after Maharashtra. These figures were the result of more widespread testing by the state. At that time, in the whole of India, about 11,500 people had been tested. Out of that, Kerala accounted for 2,550. So that meant that Kerala, which accounts for 2.6% of India's population, accounted for about 22% of the number of tests conducted in the country. Of course, the true number of cases in India were being concealed by the very low number of tests. So throughout this period, Kerala kept screening passengers who came into the state, not just by air, but also by road at 24 border checkpoints, and those who came in by trains, which was an arduous job considering the sheer number of people who travel by rail and road. What Kerala did very successfully was extensive contact tracing, whereby those who came into contact with people who were suspected to have the virus were identified and quarantined. An innovative method was devised to make this possible: route maps. Route maps containing the details of the places visited by infected persons were prepared and circulated, and the people who were present at these locations during the time when the infected persons visited those places are asked to contact the health department. The route maps are widely circulated through the social media and through an app of the government of Kerala known as the GOK Direct. The help of elected representatives of local self-government institutions and ASHA workers was also utilized for contact tracing. GOK Direct is a good example of the efforts taken by the government to disseminate information about the coronavirus outbreak. The app sends updates from the government about important developments, daily statistics regarding cases, appeals to people, quarantine protocol, and various measures and decisions taken by the government. Considering the huge numbers of migrant workers from other states in Kerala, the app provides updates in other languages like Tamil, Hindi, and Bengali. Apart from Malayalam, English, and Kannada. Kannada is a minority language, is a language spoken by linguistic minorities in the northernmost part of Kerala, adjoining Karnataka. So the formula was clear: identify, trace, isolate, test, treat. Now, identify persons who have come from abroad or other states, trace the people who have come into contact with them, isolate all of them, test those who develop symptoms and treat all of those who develop the symptoms, and treat all of those who are confirmed positive. Now, those who show symptoms are in hospital quarantine or in designated isolation facilities, not at home. Primary and secondary contacts with positive cases are also in hospital quarantine. Those who have had contact but not showing symptoms are in home quarantine. Those who have travel history from abroad or from other states are also in home quarantine. Health department officials visit or call regularly to check whether isolation protocols are being followed at home. At its peak on 4th April, 1.71 lakh people were under surveillance or observation in Kerala. 1.7 lakh were under observation at homes, and 734 at designated isolation facilities. The health department also opened call centers to provide psychological support to people who are under quarantine and to their families. And the health minister held daily press conferences to tell people what is going on, what is being done, and what the people should do. In the later weeks, more test centers were set up. 276 new doctors were appointed. 321 junior health inspectors were appointed. In Kasaragod, which was at a point of time the worst affected district and which didn't have sufficient medical facilities, the Kasaragod Medical College Hospital was converted into a COVID care hospital within 4 days. 300 beds and 20 ICU beds were prepared in such a short span of time. 273 posts were created for the purpose. 7 crore rupees equipment was set up immediately, and the Kerala State Electricity Board promised an additional 10 crore rupees from its CSR fund. A 26-member team of 11 doctors, 10 staff nurses, and 5 assistant nurses from elsewhere reached Kasaragod to coordinate the work, train employees, and treat patients. COVID care centers have now been set up in all districts, and meanwhile, other serious diseases are not to be forgotten. Cancer treatment facilities have been made available in all districts because inter-district travel will be difficult for patients during the lockdown. With the demand for masks and sanitizers going up, instead of leaving the problem to the market, the government took steps to manufacture them. The Kerala State Drugs and Pharmaceuticals Limited, a public sector company, started making hand sanitizers. Various units, including 268 tailoring units of the Kudumbashree, which is a massive government-backed collective of groups of women in the state, they started making masks. And KSDP, Kerala State Drugs and Pharmaceuticals, also increased the production of essential medicines. There was also another company, another public sector company, which started making hand sanitizers, which is Kerala Soaps. Gloves are being manufactured by an enterprise at the Rubber Park, which is jointly owned by the Kerala Industrial Infrastructure Development Corporation and the Rubber Board. Mass organizations of the youth and popular science activists are also pitching in by making hand sanitizers. Now, companies in Kerala are preparing to manufacture ventilators as well with government support. The cooperation of all sections of people has been significant in handling the crisis. The government launched the Break the Chain campaign to encourage people to adopt necessary practices to prevent COVID-19 infection. Government employees organizations have set up hand sanitizer kiosks in front of their own government offices. Organizations like Democratic Youth Federation of India, DYFI, have set up hand washing facilities in various places across the state, such as bus stops, for example. Social organizations came forward to set up such facilities in various public spaces. Kudumbashree played an active role in the campaign by conducting awareness programs for its 4.5 million members through its nearly 3 lakh neighborhood groups. Now, investments that Kerala has already made in education became very useful during this time. The state has seen a major expansion of infrastructure in public schools during the tenure of the present Left Democratic Front government. 45,000 classrooms in Kerala's public schools have been turned smart with laptops, multimedia projectors, projection screens, and sound systems. So these classrooms and 10,000 smart labs were used to screen videos prepared by the health department to create awareness about COVID-19 among teachers and 4 million students in the state's public schools. This was, of course, much before schools were closed and so on. Preparedness utmost vigilance, strict adherence to protocol, transparency, all these were crucial in Kerala's battle against COVID-19. But how did we reach there? How did we get a system which makes all of these possible? For example, if you don't have hospitals to begin with, how will you manage all this? We'll come to that later. Late March was a crucial point of time. That was when the rest of India, particularly the central government, really woke up to the threat posed by the pandemic. By this time, the Chief Minister of Kerala, Pinarayi Vijayan, had already started giving daily press conferences, because now the efforts to contain the disease and its fallout involved coordinating the work of many departments. On the 19th of March, the Chief Minister announced a relief package. This is where we now come to the socio-economic measures that are part of Kerala's battle against COVID-19. We all know that the central government announced a lockdown all of a sudden without any preparation. But the Kerala government, what it did was to gradually place restrictions. The closure of educational institutions and cinema halls was announced on March the 12th. All government programs were postponed. An appeal was made to avoid all festivals. And as it became clear that the adverse economic conditions in the rest of the world, in India and in Kerala itself, would deeply impact people's livelihoods, the government announced a package of 20,000 crore rupees on March 19th. That was before the lockdown was announced, not after. The package included loans worth 2,000 crore rupees to be made available to families through Kudumbashree, advance payment of social welfare pensions, free food grains to everyone for a month, expedited setting up of 1,000 people's restaurants which provide food at subsidized rates, a health package of 500 crore rupees, relaxation in bill payment deadlines for water and electricity, relaxation in tax payment deadlines for some sectors, and a rural employment guarantee scheme for the months of April and May, which has not been implemented due to the lockdown. The lockdown was announced on March 23rd and implemented from March 24th onwards. So that is one day before the national lockdown was announced. The state government, with its entire machinery of local self-government institutions and the rest of the government apparatus, have been engaged in providing relief to the sections of people who are most affected with the help of mass and class organizations, cooperatives, collectives, and volunteers. So the first priority was to ensure food to all. Food grains have been distributed for free to all families in Kerala without APL, BPL distinction. Food for Anganwadi children are being delivered at home. Those who are under quarantine at home and who find it difficult to access food are also being provided food. Those who find it difficult to sustain themselves if they can't go to work on a daily basis, such as daily wage workers and so on, have been identified. Senior citizens staying alone, disabled people, others who cannot cook for themselves due to illness, all such categories of people have been identified. Ward level committees of local self-government institutions, that is panchayats, municipalities, municipal corporations, they are doing this work with the help of volunteers. The committees and volunteers are ensuring that the needy will receive food and medicine. Community kitchens have been set up by the local bodies in collaboration with Kudumbashree to cook food which is being delivered to the homes of those in need. Along with the free distribution of food grains, the government is also distributing grocery kits containing 17 essential items to all families for free, again without the distinction of APL and BPL. 343 people's restaurants have been started by Kudumbashree by April 21st. The restaurants provide home delivery as well. Now, the measures to ensure food security doesn't end with just food distribution. The Kerala government has initiated steps to ensure harvest of paddy without interruption. Steps have also been taken to ensure the procurement of rice and several other crops which are being harvested. Vegetable procurement is being done under the aegis of the Kerala State Horticultural Products Development Corporation, or Horticorp. The aim is to build stocks of food grains for at least 3 or 4 months, and also stocks of other food items that can be stored. These efforts are led by the Food and Civil Supplies Department. One important element of the relief efforts that have been set in motion by the Kerala government pertains to migrant workers who are called guest workers in Kerala. So the Kerala government right at the outset recognized that the accommodation facilities for the migrant workers were mostly inadequate to ensure physical distancing. Therefore, it was decided to set up camps for them, and there had to be medical checkups for them. Food for them have been made available through the community kitchens. Arrangements have been made to provide items such as atta, potato, onion, dal, and so on to those who prefer food of the kind that is commonly available in their home regions. To ensure hygiene, masks, soap, hand sanitizer, and so on have been made available in the camps. The government is even paying to recharge the mobile phones of the migrant workers for 100 rupees to 200 rupees per person per month to help them keep in touch with their families. Mobile vans are being used to conduct health checkups. And as per the latest update from April 20th, 19,902 camps for migrant workers are operational in Kerala, with 3.53 lakh workers staying in these camps. This is the highest number of such camps operational in the country. Local self-government institutions have been given the primary responsibility to ensure the welfare of migrant workers, with the official responsibility falling on the secretary of the respective LSG. So these details are of very much interest actually. The government has also issued strict instructions that migrant workers should not be evicted from their accommodation facilities by their landlords. Leaflets, brochures, and small videos in Hindi, Odia, and Bengali are being circulated among the migrant workers to create awareness about the steps to prevent coronavirus infection. Information regarding district level control rooms have been circulated in Hindi, Odia, Bengali, Assamese, Tamil, English, and Malayalam. Health workers and home guards who can handle Hindi are being utilized for awareness programs. Home guards are visiting camps to ensure the welfare of migrant workers and explaining the steps taken by the government. I'm also quite curious to know whether any other state government in India have taken measures to disseminate information in so many different languages. If any of you know, please comment. The LDF government has also taken measures to take special care of the most vulnerable, the destitute. That is those who live in streets, sleep on shop verandas, and so on. They have been put up in secure places and food is being provided to them. Special attention is being paid to 33,000 inmates in the various care homes such as old age homes, orphanages, homes for the disabled, etc. in Kerala. Free food grains and grocery kits are being distributed to these homes as well. Medicines are being made available to them with the help of the Civil Supplies Corporation and the public sector Kerala Medical Services Corporation. Anganwadi workers have reached out to the elderly population of the state. They have reached out to about 37 lakh senior citizens and inquired about their health status. Particular attention is being paid to ensure food and safety in Adivasi areas. The police and the fire force are being used to deliver medicines to patients with serious illnesses. Social welfare pensions for 54 lakh beneficiaries, which was already announced, are being distributed. Kerala has a large number of welfare fund boards for workers of various sectors. So these were set up as a result of the powerful working class movement in the state. These welfare fund boards have announced financial assistance to workers with amounts ranging from 750 rupees to 5,000 rupees. In some cases, salaries are being paid in advance. Some boards have announced extra amounts from 7,500 rupees to 10,000 rupees for workers who get infected by COVID-19, and 1,000 rupees to 5,000 rupees for workers who are living in quarantine at home or in hospital. All workers in sectors with welfare fund boards are being provided aid through their boards. Distribution has already begun. Workers who are not part of any welfare fund board will get 1,000 rupees each. These measures have benefited 72 lakh workers. 68 lakh workers got assistance through welfare fund boards under the Labour Department and the rest through other departments. By now, some of the most crucial elements which came together to make these efforts possible must be clear. Public healthcare, public sector, local self-government institutions, Kudumbashree, and mass and class organizations of the people. I'll mention one more element which is somewhat like an offshoot of the tradition of collective action in the state, that is the volunteers. The Sannatha Sena or volunteer force initiated by the Kerala government has been a crucial part of the relief efforts. The aim was to raise a force of 2.36 lakh people of the age group 22 to 40 years. The registration was done online and the target was overshot. 2.95 lakh youth had registered as volunteers by 22nd April. Volunteers are working to identify those who need assistance, deliver food and essential items to the needy, provide emergency assistance at homes, help with the operation of call centers and control rooms, deliver materials to camps, communicate alerts, and help in hospitals. Volunteer services are also being utilized to procure locally produced vegetables for use in community kitchens. The volunteers are deployed to the panchayats, municipalities and municipal corporations as per requirement. So what is the approach that comes through all these efforts? So the efforts of the LDF government are rooted in a comprehensive approach to ensure the welfare of all citizens. This is an approach which recognizes the importance of the public healthcare system as well as other socio-economic determinants of health and well-being. It recognizes that hungry people cannot be healthy. Well-being is beyond the reach of the homeless. The LDF government's policy measures amid Covid-19 aim to address all these issues in order to provide relief to the people. The objective is to reach everybody in need until the last person. The determination to not let anybody be missed out can be seen in the fact that 1.12 lakh volunteers were deployed to identify those who need assistance, which is an enormous task which leaves room for no complacency. The strategy of the government has been to mobilize its entire state machinery, including local self-governments, along with the collective energies of the state's powerful mass and class organizations, collectives and cooperatives, as well as the seal of the citizens of Kerala for voluntary action. Since this is a talk hosted by SFI, let me tell you that the role of organizations like SFI has been crucial. A large section of the youth volunteers who have signed up for relief efforts and so on are members of organizations like SFI and DYFI. Now this strategy, which could be called total mobilization, which integrates the work of the state machinery with the work of the general public, with those mobilized by mass and class organizations playing a key role. This kind of a strategy was seen in action earlier in the rescue and relief efforts during the Kerala floods of 2018. And we could reasonably conclude that this will continue to be at the center of the left government's efforts to steer the state into recovery and advance in the coming months. But what is it that made all these possible in the ultimate analysis? We have already seen the most crucial elements: public healthcare, public sector, local self-governments, Kudumbashree, mass and class organizations of the people. Now all of these are the result of public action in the state of Kerala, or all of these are part of the public action in the state of Kerala. The actions of the government can also be categorized as one element of public action. And government action to advance people's welfare in Kerala has been a result of another kind of public action, the pressure from mass movements through protests and other methods. These have taken place over a really long period of time. Right from the time when the first communist ministry was elected in 1957, Kerala has invested in public education and public healthcare, set up fair price shops to provide food grains at subsidized rates to ensure food security, implemented land reforms which broke feudal landlordism, which also increased the living standards of the peasantry and the agricultural workers, and in turn which increased the bargaining power of agriculture workers and even other workers. The working class movement has played a crucial role in Kerala's wage rates being the highest in the country, and it has been the most important factor in Kerala having the most wide-ranging set of social security measures for workers through the welfare fund boards. Democratic decentralization is something that the left has championed over a long period of time. The biggest effort in that direction was the People's Plan campaign, which was initiated by the Left Democratic Front government, which was in power during 1996 to 2001. This is how the LSGs were really strengthened, through the campaign of the People's Plan. with devolution of funds and powers to the Panchayati Raj institutions. Kudumbashree, the organization of women organized in self-help groups with government support. There are now about 4.5 million women organized in Kudumbashree. This is also something the left has initiated in 1998 and strengthened in its subsequent 10 years. Public health care, that has received its biggest boost in the last 4 years during the tenure of the present left government with the Ardram mission. All primary healthcare centers are being upgraded to family health centers. Facilities in all government hospitals have improved greatly. Right now, the top 12 primary health centers in India are in Kerala, according to official rankings. This is what has really enabled the healthcare system of Kerala to stand up to the challenge posed by Covid-19. And remember, in February this year, the central government had proposed that the district hospitals in Indian states should be privatized, and Kerala said no. I would like to address one question that is often, or one point that is often raised by people, which is the argument that all these that I mentioned right now constitute a bipartisan effort. There are people like Shashi Tharoor, for example, who make these claims. Is it really a bipartisan effort? In some cases, public action from below, that is the pressure from trade unions and mass movements and so on, have ensured that the right wing in Kerala, which is led by the Congress in the state, has not been able to roll back many of the initiatives of the left completely. Nevertheless, many of these efforts were things that the right wing has tried to scuttle in the past. It has diluted land reforms legislation when it came to power. It has cut funds to local bodies when it came to power after the People's Plan campaign was set in motion. It has tried to weaken Kudumbashree. It has tried to smash the working class movement, the trade unions. It has run down public sector enterprises. Although they have been not successful in closing down public sector enterprises because of protests by trade unions, they have managed to, whenever they came to power, they managed to run them into losses. And you see this time and again, when the left comes back into power, it turns around those public sector enterprises. Now, one public sector enterprise which has been crucial in the fight against COVID-19 has been the KSDP, Kerala State Drugs and Pharmaceuticals Limited. I had mentioned it earlier. This is one good example. This was a company which was run down by the previous Congress-led government. The present government, when the LDF came to power in 2016, turned it around, and now it is right at the forefront of the battle against coronavirus. Now, I would like to just conclude with the lines of Che Guevara from a speech he made to medical students and workers in 1960, which is as follows. The revolution's task, the task of training and nourishing the children, the task of educating the army, the task of distributing the lands of the old absentee landlords among those who sweated every day on that same land without reaping its fruit. This is the greatest work of social medicine that has been done in Cuba. I believe these words are applicable to Kerala as well, notwithstanding the fact that Kerala hasn't had a revolution and nor is Kerala socialist. That is something that we need to be careful about. Socialism is a mode of production. Kerala is not a socialist economy. It is one province in a capitalist country. Its government is led by a communist party which has the establishment of socialism as its objective. But let us not have illusions about where we are at the present. If you have illusions, you will be quickly disillusioned. I would like to conclude with that.